Mycetoma. Mycetoma is an example of subcutaneous mycosis. The agents of subcutaneous mycosis usually inhibit the soil. They enter the skin by traumatic inoculation with the contaminated material, and they tend to produce granulomatous lesions in the subcutaneous tissue. So, mycetoma, it is an example of subcutaneous mycosis. It is a chronic, slowly progressive granulomatous infection of skin and subcutaneous tissue. Okay, so mycetoma is an infection of skin and subcutaneous tissue. इसमें granulomatous lesions का formation हो जाता है, and it's a chronic condition, और ये बहुत धीरे धीरे progress करता है. ठीक है. So this is a figure of mycetoma. When mycetoma happens in food, this is how it looks. It is a granulomatous lesion. So there is a triad of mycetoma, that is swelling, discharging sinuses, and presence of granules in the discharge. So in mycetoma we find a triad, which is swelling, discharging sinuses, and there will be granules in the discharge. Mycetoma is also known as Madura mycosis or Madura foot, as it was first described in Madurai, South India by John Gill. ठीक है, तो माइसेटोमा को मदुरा माइकोसिस या मदुरा फूट क्यों बोलते हैं? बिकॉज इट वॉज फर्स्ट डिस्क्राइब्ड इन मदुरई. Then types of mycetoma. There are two types of mycetoma: eumycetoma and actinomycetoma. Eumycetoma, it is caused by a fungal agent, and actinomycetoma is caused by a bacterial agent. दो टाइप का माइसेटोमा होता है, eumycetoma which is caused by fungal agent and actinomycetoma is caused by bacterial agent. Let's see the difference in clinical manifestation of eumycetoma and actinomycetoma. Eumycetoma caused by fungus, actinomycetoma caused by bacteria. तो eumycetoma का जो ट्यूमर है that is single with well defined margins. Sinuses of eumycetoma appear late and they are few in number. The discharge is serous, black and white grains are there, osteosclerotic lesions are there in bone, and the grains contain fungal hyphae greater than 2 micrometer. Eumycetoma में tumor is single with well defined margins. The sinuses appear late and are few in number. The discharge is serous type. There will be black and white grains in bone. Osteosclerotic lesions are there, and the grains will contain fungal hyphae greater than 2 micrometer. Actinomycetoma, multiple tumor masses with ill-defined margins. The sinuses appear early and they are numerous with raised inflamed opening. Okay. The discharge will be purulent as it is caused by bacteria. The grains are white or red in bones, osteolytic lesions, and the grains will contain filamentous bacteria less than 2 micrometer. So this is the difference between eumycetoma and actinomycetoma. Eumycetoma, single tumor; actinomycetoma, multiple tumor. Eumycetoma, well defined margins of tumor. Sinuses appear late. Sinuses are few in number. The discharge is serous. Grains black and white. Bones will have osteosclerotic lesions. Grains will contain fungal hyphae greater than 2 micrometer. Actinomycetoma, multiple tumor with ill-defined margins. Sinuses appear early. They are numerous with raised inflamed opening. Discharge is purulent, grain white or red. Bones will have osteolytic lesions, and the grain will contain filamentous bacteria greater than 2 micrometer. So eumycetoma and actinomycetoma, they differ from each other by various properties like color of granules or grains and also in clinical manifestation. Third category of mycetoma is botromycosis. Botromycosis is refers to a mycetoma like condition which is caused by a bacteria such as Staphylococcus aureus. So botromycosis is a mycetoma like condition which is caused by Staph aureus. Pathogenesis of mycetoma: the causative agent will enter the skin or subcutaneous tissue from contaminated soil, usually by accidental trauma, थॉर्न prick या splinter injury के कारण जो agent है that will enter the skin and subcutaneous tissue. Then the disease evolves slowly. It is a slow progressive disease. Initially microabscesses are formed by the polymorphs and replaced by chronic granulomatous tissue and in skin and subcutaneous tissue. इनिशियली माइक्रो एब्सेस होता है, ठीक है, और फिर बाद में chronic granulomatous tissues बन जाते हैं. Agents of mycetoma and the type of grains they produce. Eumycetoma which is caused by fungus. तो eumycetoma में जो granules होते हैं वो black हो सकते हैं या white. Black granules are caused by Madurella mycetomatus, and Madurella grigia. Then Exophiella genselme and Curvularia species. The white granules are caused by Pseudolecheria baudi, Aspergillus nidulans, Acrimonium species and Fusarium species. ठीक है, तो eumycetoma में ब्लैक ग्रैन्यूल्स या वाइट ग्रैन्यूल्स होता है. ब्लैक ग्रैन्यूल्स बाय Madurella mycetomatus and Madurella grigia. White granules by Pseudolecheria baudi and Aspergillus nidulans. Actinomycetoma में white to yellow granules are caused by Nocardia species, Streptomyces somaliensis and Actinomadura madure. It is most frequent cause, significantly outnumbering the cases caused by Nocardia. एक्टिनोमाइसेटोमा जो कि बैक्टीरिया से होता है, उसमें वाइट टू येलो ग्रैन्यूल्स जो है, इट इज़ कॉज्ड बाय नोकार्डिया स्पीसीज, स्ट्रेप्टोमाइसिस सोमलियंसिस और एक्टिनोमडुरा मडुरे. एक्टिनोमडुरा मडुरे, it is the most frequent cause. Pink to red granules caused by Actinomadura pilletieriae. Clinical manifestation: hallmark of mycetoma is presence of clinical triad consisting of tumor-like swelling, that is tumefaction, discharging sinuses, and discharge oozing from sinuses containing granules. Feet are the most common site affected, although any site can be involved. There may be involvement of underlying fascia and bones, producing osteolytic or osteosclerotic bony lesions, and these lesions are usually painless. Treatment of mycetoma consists of surgical removal of the lesions, followed by the use of antifungal agents for eumycetoma like itraconazole or amphotericin B for 8 to 24 months, antibiotics for actinomycetoma such as Wells regimen, amikacin plus cotrimoxazole.